Siaya County government has received equipment worth millions of shillings from two non-governmental organizations to help in the fight against tuberculosis, malaria, and neglected tropical diseases. The donations worth more than 54 million Kenyan shillings included laboratory equipment and reagents from Amref African Health and two portable artificial intelligence-powered chest X-ray machines from the Center for Health Solutions, CHS.
This partnership, both with CHS and Amref, is exceptionally having a positive impact in delivery in health services.
Speaking while receiving the equipment, Siaya Governor James Orengo hailed the organizations for supporting the county in its effort to offer quality health services to the residents. Orengo said that Siaya, like other counties in the Lake region, is a high disease burden county where interventions by both the county and national governments cannot be sufficient.
In the county and in our administration, we have emphasized health as a key pillar in our service delivery. The disease burden in Siaya and in the rest of the counties in the Lake region is very high. And in the interventions by the county governments, including the Siaya County government and the national government, cannot be enough, cannot be sufficient. And if one had to enumerate the assistance we have had from CHS and Amref over the years, it is absolutely invulnerable. And as you know, every year we have a crisis about the share of equitable revenue between the national government and the counties. And these discussions sometimes go on way into the last months of the financial year. I would not apologize if I repeated that the disease burden again is very high, particularly in the area of HIV, malaria, tuberculosis, and some of the ones which have been mentioned. The partnership has now enabled us to get equipment and tools for screening and diagnosis. I'm excited that this equipment applies artificial intelligence. And I was recently out at the country, and AI is becoming very important in our conversation in all sectors, including nuclear medicine, which we don't practice here. So I want to thank you, thank SHS. The donation, I'm told, the equipment is worth 34 million. Can you clap kidogo here? 34 million. Thank you so much, Dr. Wakesa, for this. Yeah, and God bless you. And similarly, Amref, you've been told what this equipment is for, including bicycles. Nyamrerwa, without you, we cannot be able to reach people out there who require our services and interventions. And we cannot do enough for them. They get a stipend. I'm waiting for the day when they can earn something a little bit better. But with these bicycles, I think is going to enable you to have better movement on the ground, mashinani. And I am told, together with the equipment for screening and diagnosis, we have a donation of over 17.5 million from Amref. So this afternoon we are talking about donations which are worth more than, is it 52, nearly 52 million. So it's a good day. It's a good day for us.
AMREF Health Africa's Deputy Director Gilbert Wangalwa, who presented an assortment of laboratory equipment and bicycles to be used by community health providers, said the organization was committed to supporting initiatives aimed at eliminating endemic diseases in the region.
On behalf of AMREF Health Africa, in the journey of eliminating neglected tropical diseases in this region and in this country, we join you, the county of Siaya, to be able to donate laboratory equipment and reagents that are going to go into the effort of eliminating neglected tropical diseases in this county. On that addition, also we appreciate that malaria prevalence in this county is very high, and therefore we are also donating bicycles to community health promoters to enable them. I can hear the excitement. To enable them to be mobile, to be able to reach out to more households and to refer mothers and children who they have been able to identify with signs of malaria. So in that effort, we really appreciate that we also try to minimize or reduce malaria prevalence in this country.
The Chief Executive Officer of the Center for Health Solutions said tuberculosis remains a major health burden in Siaya.
We've been a partner of the Department of Health at Siaya County for the last 8 years. Today, the purpose of this visit is to hand over new equipment to the Department of Health in Siaya County. This will support with the screening and diagnosis of tuberculosis. Tuberculosis, as you know, Siaya is a high burden county for tuberculosis. We are donating 2 additional digital chest X-ray machines that are portable, that are powered by artificial intelligence to help improve screening and diagnosis. This follows a previous pilot in Madiani facility where about 2 years ago we had a pilot of the use of this equipment. Since then, there has actually been a quadrupling in terms of the numbers of cases of tuberculosis diagnosed because of the artificial intelligence that powers this equipment. And we are proud to make this donation of worth 34 million Kenya shillings. This has been made possible by our partnership with the United States government through Centers for Disease Control and Prevention, CDC.
William Khaemba, Kurunzi News in Siaya County.